According to the Centers for Disease Control and Prevention, drowning deaths in the United States are on the rise. In fact, drowning is the #1 cause of death for children 1 to 4 years old and the leading cause of accidental death for those ages 5 to 19. By race and ethnicity, the highest drowning rates were among non-Hispanic American Indians and Black Americans. Dr. Nidhi Kumar is on call to tell us more about this and how to be safer this summer. Welcome.
Welcome. Thank you.
And why do we see the racial and ethnic disparities in drownings?
According to the CDC, about 40 million Americans do not know how to swim. 1 in 3 Black Americans report not knowing how to swim. About 40% of Black Americans and 30% of Hispanic Americans have never had swim lessons. Well, why? There are a lot of barriers: cost, access to swim lessons in certain communities, lack of public swimming areas like safe pools in certain communities, and then lack of diversity amongst aquatic staff. It's very important that people feel comfortable with the staff that would be there teaching them and supervising them. Now, swim lessons have shown to reduce drowning up to 80% in young children.
And let's talk a little bit about the signs of drowning. What exactly is a dry drowning?
Well, first of all, signs of drowning. Drownings occur silently and quickly. So what they tend to portray in the movies, where somebody's screaming and flailing their arms, really doesn't occur. So you need to be extremely vigilant if you are supervising children in a pool. A dry drowning occurs when someone has come out of the pool, however, they've had a submersion. So maybe a child has been swimming all day and they took on a lot of water through their nose and their mouth. Once they're back on land, it can happen minutes to even hours later that a child can experience cough, shortness of breath, nausea, vomiting, and signs of low oxygen like fatigue or irritability. So it's important that if your child has spent the whole day in the water and they're not acting, quite normal once they've gotten out, to, consider this as a possibility and get medical attention.
And now we are looking at a heat wave later this week. What are your suggestions for people to make sure they stay safe?
Well, most importantly, you want to really limit your time outside and you want to stay hydrated. Now, I need to point out that caffeine and alcohol dehydrate you. So it's important to really avoid those things. If you are in a house that doesn't have great air conditioning, stay downstairs. Heat tends to rise. And in the hottest part of the day, go to a public building, go to a movie, go to a library, go to a mall, go someplace so you can really cool your body temperature down, and avoid outdoor exercise this week. This is not the week to go out and start training for that marathon.
And can you give us an idea of the symptoms that something is really wrong when you're out there in the heat?
Well, initially people can start to feel dizziness. They can start to experience fatigue, irritability. One real hallmark is that you notice that you stop sweating, you stop cooling down. And once you've got into that point, you're at very high risk for heat exhaustion and even heat stroke. So really, if you have to be outside, in particular people who are working outside, it is important to stay hydrated and take breaks. Get inside, cool yourself off. Even a 10-minute break will go a long way.
Dr. Nidhi Kumar, such good advice for us today. Thank you so much.